So moving on to the next session. Next session is by Dr. N.K. Singh from Dhanbad. He has an interesting talk that is on new updates on exercise in type 2 diabetes. What does the ADA 2021 says? To chair this interesting session, we have Dr. Ajit Kumar, consultant of diabetologist and food specialist from Trivandrum, and Dr. Jitendra Nagar, consultant diabetologist from Ahmedabad. Over to the chairperson for further proceedings, please.
Thank you. Good afternoon, ladies and gentlemen. First of all, I would like to thank dear friend Aravinda and his team for inviting me for this session. And I think we are running short of time. I'll straight away go to the topic. I think the topic for discussion is, as Dr. Aravinda said, it is a very important topic. As a diabetologist in day-to-day practice, we almost always we get one question about which type of exercise we can do and when we can do, what is the ideal time of doing exercise, all that queries we get. I think for clearing all our doubts and what do you call throwing new informations, we have Dr. N.K. Singh from Dhanbad. He's a diabetologist and a physician. He is working at Devi Diabetes and Heart Research Center based in Ranchi. Actually, I always have a soft corner in Ranchi. I spent 3 years there when my wife was doing it, MD in ribs. It's a nice place. Other than Dhoni, I think Ranchi should be famous for so many other things, natural beauty and other things. So he has given interview in various health-related topics. His areas of interest is diabetes. He's the founder of CME Group and RSSD Case Discussion Group. He's the chairman of RSSD Jharkhand, and I think he's a national speaker for most of the diabetes conference in India. I think I hand over the session to Dr. N.K. Singh, and thank you once again for Aravind.
Uh, with great gratitude again to my friend, Dr.
Sir, you
Arvinda.
have to unmute, sir.
Yeah, just sorry. Uh, Respected chairpersons, thank you very much for the nice introduction. And thank you very much, Dr. Vinda. He is now doing this great Olympic, and he is due for the winning the gold medal in this conference. I am pretty sure. Well, let us do our work. Just 1 minute. Let me share my slides. Yeah, I think now is it visible, sir? I think it is
Yes,
visible.
yes.
Yeah. Well, so uh, Dr. Arvinda gave me a very unique topic, the new updates on exercise in type 2 diabetes and what happened at the ADA 2021 last month. My motto today is to tell you that exercise is muscle mitochondrial medicine and it is very, very important to us. My agenda is very simple. You know that if you attend the ADA and the ESD, that is the Mahakumbh of the diabetes, each year they devote at least 8 hours just to discuss exercise. But we in India hardly do it. I am really thankful to ADC and Dr. Vinda. He is an exception for that, and he is kind enough to keep this topic. So I will just tell you in 5 minutes about the basics and three things which the ADA discussed this time. As the chairman was very curious, they discussed about the timing of the exercise, seat and break of the exercise, and hits exercise as hero. So this will be the most important things. And this is also a slide from the past ADA where this lady told that any movement is better than none and appreciate the levels of sustainable behavior change. I don't know you believe it or not, for every 1 hour of aerobic exercise you do, you add 2 hours to your lifespan and your general health improves to enhance the quality of your life. So this is a big message. And this slide I always show where I met this type 1 diabetic. The Not Dead 8 is a book written by him. Sorry, not a doctor, but he's a type 1 diabetic and the founder of the Novo Nordics this type 1 foundation, that is the Phil Sutherland, and he always tells that this is the $1 billion drug that never gets prescribed. Lots of things happening when do you exercise. Apart from the improving your memory, increasing the osteocalcin, or prevents injury associated loss of BDNF, so many things happening at the same time. But very important point to understand today in 2021, that exercise induced mitophagy, its role in mitochondrial quality control by exercise training. So a gradient difference in mitochondrial color from green yellow you can see here to red represents healthy stress and damaged or dysfunctional mitochondria, and it is quite clear here. You can see that from the sedentary point, where what is the color there, you can see here sedentary, what is happening if you are doing exercise. So believe it, this is a great science. And acute exercise induces further mitochondrial stress and initiates the process of removing damaged dysfunctional regions of the reticulum through mitochondrial fission and mitophagy. This is a big thing which is happening. मैं यहाँ यही बोलूँगा कि समझदार को इशारा काफ़ी है. So my point is that if the molecular mechanism gets imprinted on your psyche, it acts as a motivational force to do the regular exercise. This is very, very important. So exercise journey starts its job by placing an energy demand on skeletal muscles. With utilization of glucose and fatty acids, generation of adenosine triphosphate occurs, and both insulin and exercise increase a skeletal muscle glucose uptake by translocation of the glucose transporter. So this is very important again. And just by doing exercise, what you are doing, that increased insulin sensitivity, increased oxidative capacity, and increased mitochondrial content. So increased mitochondrial content is very, very important these days, and intense research is going on. And I'm great pleasure, I want to tell you again that you just understand the science of CMGU. What is CMGU? It is the contraction mediated uptake which occurs when we exercise. And this is a form of non-insulin dependent glucose uptake. So what is known is that the pathway is not affected by people with type 2 diabetes. CMGU continues for several hours post-exercise. This is a great message to know. And if you do exercise by aerobics or by resistance, remember what is happening. The exercise acutely enhances insulin sensitivity, both aerobics and resistance, up to 20%. But you can see here, when you combine aerobics and resistance training regimes, they improve the sensitivity by 70%. And lower HbA1c levels, you can see here 0.9%. ये किसी भी दवा से better है. So this is the message. And when you do exercise, there is inter-organ crosstalk and substrate flexes during exercise. बात निकलेगी तो दूर तक जाएगी. When you do exercise, these molecular factors are likely to contribute to the exercise health benefits. Remember. Now let us move to the ADA presentation number 1. The first presentation was that the enhancing the safety of indoor exercise in era of SARS-CoV-2 mask use during exercise training. You can see here what is happening when you exercise generates aerosols. The pre-exercise, the more intensive exercise, the more intensity of exercise is, you can see how aerosols are generated. And enhancing the safety of indoor exercise has some facility issues like the air changes per hour, the filtration, and other consideration we don't have to discuss in detail today here. But remember how to protect your staff, how to protect your participants and metabolic cards. So minimize the number of personnel which use the PPE, frequent hand washing, you know everything for that. But most important point today, the role of exercise in the COVID era, that when you do exercise, that stimulates the interchange of innate immune system. Innate immune system is so important, and components between the lymphoid tissues and the blood compartments. There is a great research which has shown these things. A transient, a summation effect occurs over time and improved immunosurveillance occurs, and this is very, very important. You can see here, even in the COVID era, if you do the exercise, that boosts your immunity. There is a evidence today that each exercise bout and the anti-inflammatory and antioxidant effect of exercise training have a summation effect over time in modulating the tumorigenesis, atherosclerosis and other disease process, including the COVID. But now the people ask you which type of exercise should we do, the aerobics or resistance. जवान रहने की चाहत रखना ही काफ़ी नहीं. If you want to keep yourself in the youth, do the resistance training. This is very critical for all of us. Normal loss of muscle mass with aging. So there is accelerated loss of muscle with physical inactivity. So carbohydrate storage tank is very critical. So this is very, very important. Now the aerobic training, the neuromuscular adaptations you can do. With resistance training, so many things you can do. With metabolic adaptations you can do. You can see here in this PPT, and there is no time to explain everything, but remember that aerobic exercise leads to increased capillary density, mitochondrial size and volume, oxidative capacity and improved substrate utilization. But resistance training also leads to increase in lean body mass and a strength and improved of glucose utilization. So always you should demystify that which one is important, the intensity or the duration. This is always asked. So current research clearly demonstrates that intensity is more important than the duration. Remember, intensity is more important than the duration. At low intensities, if you do the exercise an extended period of time, the fat becomes the primary fuel source. This is far less effective if you want to lower the blood glucose. But when you do exercise with intensities ranging from moderate to high, they utilize more carbohydrate, the glycogen for fuel, therefore are more effective at lowering the blood glucose. Now, know your limits. See this marathon, how it started when the Greeks sent there the fastest run to carry news of the victory, and he sprinted 26 miles from the battle site at the city state of Athens. He arrived and said, "Rejoice, we conquer," and died. So know your limits. That is very, very important. And for that, the next talk at the ADA was timing is everything, meal and exercise. Remember, so timing, what time? Advice to work after meal is more effective for lowering postprandial glycemia in type 2 diabetes. But remember that now there is also research saying that afternoon exercise is more efficacious. Why? Because the glucose tolerance, insulin sensitivity and muscle oxidative capacity show circadian oscillations. Interactions between these factors could lead to divergent physiological adaptations to exercise timing at different times of the day. And human skeletal muscular strength and mitochondrial function peak at late afternoon, suggesting a circadian rhythm of oxidative metabolism. So several lines of evidence suggest that timing of exercise alters physiological response diversely. Very, very important today. And even with their research, this is a very research which has just appeared in Diabetologia that shows that the afternoon heat, if you do, was more efficacious than the morning heat in improving the blood glucose levels. You can see here in the graph. So is there an ideal time to exercise for establishing exercise habit and regulating body mass? Whatever the message from the last slide I showed you, now see what the ADA people saying, this gentleman saying, the time of day that exercise is performed, the amount of time per exercise is performed, time is a barrier to exercise you have to consider, and adherence to exercise over time you have to consider. So lots of factors are saying that each morning the ideal time to achieve higher exercise levels. Here we are talking about the achieving higher exercise levels and far from an exercise habit. And this shows that even the Brahmrot, there are now lots of things are again changing. That if you do the exercise in the morning, there is consistent morning exercise, that leads to more action. Everything is energy. So initiation you can do, learning you can do, and you can stability you can do by morning exercise, and you can come back in action again. This has been shown by few research which I am showing the things. So they showed that if you do a moderate to vigorous physical activity, and they compared the groups by doing the exercise in the morning, midday, afternoon, and evening, they showed that the variable timing group had highest bouted of moderate to vigorous physical activity levels. And morning group, the second most active, remember, and the main most active in the morning tended to be most fit. But remember here, they also showed that main most active in the morning also had higher CHD risk. So this point should be also taken care. So the research is clearly showing that there is greater percentage of doing moderate to vigorous physical activity if you do in the morning. That is quite clear from here. So he concludes that there was a little evidence that the specific time of day that exercise was consistently performed related to the MVPA levels at either time point. So he summarized that most studies suggest that exercising as a consistent time is favorably associated with amount of moderate to vigorous physical activity that is performed and accumulated. But does that specific time of day matter? Among initially low active individuals with obesity, consistent morning exercise related to achievement of higher MVPA levels. And could consistent morning exercise be an effective strategy for increasing MVPA levels among insufficiently active individuals with obesity? Even the persons in who WLM, that is the weight, they have lost the weight loss maintainers. This has been again shown that the consistent exercise was more common if they did in the morning time. The second part they discussed about the sitting time, which everybody knows that today we basically 13 hours sometimes we sit. So what they showed, I will say straight go forward to the ADA slides, that the interrupted sitting, that is very very important concept, you are aware. So interrupted prolonged period of sitting with 15 minutes of walking after meals and either light walking or simple body weight resistance activities undertaken for 3 minutes after every 30 minutes of inactivity can improve overall blood sugar control. And this has been shown in the trials. The trials is quite clear. Even though you are doing some light intensity walking after some sitting, or you are doing SRA, that is a simple resistance activity, that is a big thing to, for what? That attenuates acute postprandial glucose, insulin, C-peptide and triglyceride responses, and this has been shown. Even the very daily movements is very very important, and this many things have been presented where dog ownership and physical activity has been correlated, and this is quite good to just break your sitting pattern. And this presentation from the Baker by Mr. David, that reducing and breaking of sitting time, does this work? This was a very important topic covered at that point, and this showed, I will take 2 or 3 minutes more, high sitting is associated with increased risk of chronic disease. This has been shown. So average daily sitting they calculated, and sitting the right balance, you can see what happened in the pre-COVID era and post-COVID era. You can see here that this one is the sedentary time. LO is the sum of time spent in light intensity, and this one is sum of time spent in moderate to vigorous activity. These are definitely down, they are going to downside to these days. So breaking of sitting time leads to increased muscle activity, remember. I will not go in details how it works, but don't meet physical activity guidelines. These things you can see here, very important slide, and this is slide is I think I had not still this is ahead of print. I am showing with permission of the ADA. They didn't allow to do this, that the during the usual 24 hours day, what is happening, if you see the physical activity per day more than 60 minutes, and if you just hours of sitting per day more than 8 or less than 4, it is still, if you are exercising or you are doing physical activity per day more than 60 minutes, it is low. But if suppose a person here we just have a physical activity of less than 5 minutes. But still, hours of sitting per day, if it is more than 8, it is high. But if the hour of sitting per day is less than 4, it becomes medium. So message is quite clear. I think message is very, very clear here from this very important research. How to, I'm not going to detail here, but remember the postprandial effect of breaking sitting times leads to many things, many things. You can see here in tune of glucose, insulin, and triglycerides, everything improves. From the 33 studies they showed how the body weight decreases, BMI decreases, waist circumference decreases, body fat increases, systolic BP increases, fasting insulin increases, and HDL increases. So this is quite evident here from, so the ADA also says about this. And this is the shared approach to sitting less and moving more. And the next thing which the lastly was discussed was about the heat intensity interval training. And what is high intensity high intensity interval training they told? What is the cardiometabolic benefits? Why might high heat be physiologically beneficial? And why the heat is hated? So this is a very, very important thing. I think you are well aware that a form of interval training, a cardiovascular exercise strategy, alternating short periods of intense anaerobic exercise with less intense recovery period. This is known as heat. And I will not go to tell here if the becomes maximal to supramaximal, it is known as SIT, that is the sprint interval training. And if you are doing the intensity to near maximal, it is the HIIT. So it is more enjoyable. Be assured this is more enjoyable, and this is very important, the beneficial effect on the glycemic effect. You can see doing a HIIT here and what is happening with the continuous aerobic training, and this is quite clear here, the beneficial effects here. इसका जवाब नहीं है. So HIIT or SIT, HIIT all the time, cure to inactivity, this is the cure to inactivity epidemic, that is the thing. So why might it be physiologically beneficial? I straightforward go to the last slide of take-home points, that the low volume HIITs is efficacious for improving various aspects of cardiometabolic health. In variety of populations, HIIT may have advantage related to the time efficiency on, of pattern and of muscle fiber recruitment. And many people conflate HIIT with SIT, or it is unlikely low volume HIIT is the only type of exercise people do. But HIIT may be attractive vigorous intensity exercise. Option is naturally progressive and can be adapted to many modalities. And HIIT is one exercise tool amongst many that elicits numerous health benefits and everyone. So concluding my talk now, I will lastly say that when so many things are important in the art of exercise, then the guiding question is why don't most people prioritize and sustain the self-care behaviors like physical activity? Why they are not doing every day? So, but inactive individuals might not know that the movement can help them feel better, and this will be better now. So, just finishing my talk here, इस पथ पर वे चलते हैं जो चलने का पा गए स्वाद, जिससे पथ पर स्नेह मिला उस राही को धन्यवाद. Thank you very much for the giving this unique opportunity and tell you the recent message. Thank you. So I will just stop sharing here, and if you have any question, I would happy to tell you.
Thank you very much, Dr. N.K. Singh. You are always energetic, enthusiastic, and your talk was full of perspiration. And you very well said, Jawan rehna hai, lamba jeena hai, so do walk, do exercise. Pandemic has also taught us the importance of the exercise, and we people are the role model for the society. So we need to put some text and photographs doing exercise to show the public. Yeah. We can motivate people more and more. Your talk was, again, I will say, you are known for your academic versatility as well as your eloquence. It was excellent talk. Thank you very much, Dr. N.K. Singh.
Thank you, sir.
Dr. Arvinda, thank you very much for inviting us to chair this session. I would like to give a suggestion. You just give a live demo how to prepare this filter coffee. I am very much fond of filter coffee, but North Indians don't know how to prepare it. But thank you very much. Thank you very much.
Thank you. Dr. N.K. Singh, apart from your activeness in CME group and RSSD case discussion group in WhatsApp. We thoroughly enjoy that discussions, and that keeps it updated every day. So, going on to your talk, one simple question: what is your advice on exercise for doctors in this pandemic?
So doctors already our chairpersons told you that you should be the role model. So
Yeah.
even today, I think I have done my 1 hour 60 minutes of walk, and at least 30 minutes I walk with my dog. So you just buy a dog, and I will tell you to buy a golden retriever, that is a perfect family dog, and he will tell you how to, when you are when I keep myself just lying down, he just comes to me, and every 2 hours or 1 hour in between I have to go to outside to just to have some activity. So I think this is a great message, although in a light sense, but it's a great message that you must have also interrupted sitting pattern, that is very important. Yeah, Dr. Yeah, Dr. Ajit
Ajit,
Kumar. Yeah,
Dr.
Dr.
Ajit.
Singh, I have a small query.
yeah, yeah.
What will be your advice for neuropathy patients and peripheral occlusive arterial disease patients in terms of exercise?
Yeah, sir, in that cases, I think the resistance exercise is a great thing. Whenever my many patients of neuropathy come with even the arthropathy and the osteoarthritis, in that cases, the straightforward I go that I will give you a demo at the home exercise system. There are lots of home exercise system that is available on the YouTube also, where by doing the simple resistant exercise, you can do all of the benefits which you want to do by doing also the aerobics. So for that patients, I will always say that you go straight forward for the resistance exercise, and also yoga and some other sorts of many exercise are coming up. And if possible, Surya Namaskara is very, very important. That is a combination of both resistance and aerobics. And also if you do with the mantras, that is the great thing, because that also cools your mind. So I will again say you, if only doing a 6 round of Surya Namaskara, if you don't have time, it takes only 10 minutes. That is nothing like that in this world. This is my opinion.
Thank
Wonderful,
you.
sir. Wonderful.
Would like
Dr.
to ask your
Preeti,
opinion on a
Dr.
very
Preeti, you want to
important.
ask?
Yeah, yeah. Sir, NK Singh, sir, I just want to ask you, like, if the doctors are sitting for long hours of duration, like maybe 8 hours in a OPD, so what would you suggest, like, what would be the interval of exercise that we can inculcate between the sessions of consultation, like?
I think at least you can must do at least break after 1 hour. This is very, very important, and I think I know Dr. Brij Mohan. He is just smiling. He always sometimes see the patients not sitting. Sometimes even stand up and see the patients. I know, sir. So many things you can do just by sometimes just if I do my echo at near to my patient side. So what I do, I break my chain by sometimes remain standing to some time. There are lots of research also saying that if you remain standing, lots of metabolic effects happening. So at least after 1 hour, you can take a break. You can have some 2 or 3 minutes of a small walking around the hospital or again the OPD, and that is a big thing. And when there are lots of things also, I discussed at the ADA for that, and they showed that there are lots of benefits happens inside the body. So I will tell you to at least after 1 hour, if possible, 30 minutes. Otherwise, at least after 1 hour, you must break for 2 minutes or 1 minute. Dr. Brij Mohan sir might say
Yes,
something about that.
I like to add that what do they say? Sitting is new smoking.
Yeah.
What I have done
Yeah.
in my OPD is to place the patient away from me. That helps in both ways, preventing COVID. And whenever you have to examine, you need to exert yourself. You need to go to him or her and examine, chest examination, whatever you have to do. So probably the best way for a busy practitioner like Arvinda and NK Singh is to do something as early as possible, not necessarily waiting for 1 hour.
Yeah.
That the clock says 1 hour is over,
Yeah.
and now you have your walk.
Yeah, yeah.
I always advise one interesting exercise to all my patients. Can you guess what is it? Just before the food, they sit for the food. I tell them one important exercise. That is
Dance.
Yeah, good.
So,
Yeah,
just doing that because somebody asked them to have sweets, they should at least say no.
yeah. Good.
So thank you, Dr. M.K. Singh, for a
Thank you.
wonderful insight on a very interesting topic of exercise in
Thank you. Thank
diabetes,
you.
the latest ADA 2021 guidelines. Thank you so much. And thanks, Dr. Ajit and Dr. Jitendra Nagar, for chairing this session. Thanks for being a part of our session. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you.
Thank you very
Thank
much.
you, Arvind.
Thank you.
Thank you. Namaste.
Thank you.